Hey, so we are gonna go ahead and get started. My name is Gail Smaller Jr. I use he, him, his pronouns, and I serve as the Associate Director of DEI here at the School of Public Health, Twin Cities at the University of Minnesota. Before we begin, I first want to acknowledge that the School of Public Health at the University of Minnesota Twin Cities is built within the traditional homelands of the Dakota people. Minnesota comes from the Dakota name for this region, Minnesota Makoche, which loosely translates to the land where the waters reflect the skies. We will share some concrete resources for supporting our Indigenous relatives in the chat shortly. I also want to point out that closed captioning is also available. You can access that by using the icon in the bottom right corner of your screen. You can also reach out to Sarah Harris, who is providing our tech support today, via the chat to ask questions about accessibility. We will monitor we will also monitor the chat for any additional questions related to the presentation or for our speaker, as well as share links to our evaluation and information about future GIF events. The Justice in Public Health series was started in 2021 as part of the School of Public Health's commitment to justice and anti-racism. We have been hosting monthly events with local and national experts around topics of public health. The speakers and presentations in the series help to ground us in theory and practice, as well as complement the classroom learning that our students experience. We also hope that today's discussion is part of broader change happening outside of SPH. If you are interested in staying abreast of our other justice and public health events, please be sure to fill out our event evaluation after this and check the box to receive notifications about upcoming events. You may also visit our website at any time. Now, I would like to welcome our speaker for today. Amira Adawe is a distinguished leader in public and environmental health with over 17 years of experience in programs, research, and policy. She is the visionary founder and executive director of the Beautywell Project, a nonprofit dedicated to combating colorism, harmful skin lightening practices, toxic chemical exposures, and promoting community health literacy globally. For over 13 years, Amira has been instrumental in training government agencies worldwide to combat the illegal trade of mercury, hydroquinone, and other toxic chemicals in skin lightening products. Since 2020, she has served as a key advisor to the UN Environment Program's Element Eliminating Mercury Skin Lightening Products Initiative, chairing the inaugural global stakeholder meeting in 2023. Her expertise extends to her role as a senior advisor to the federal government of Somalia's Ministry of Environment and Climate Change, shaping national strategies at the intersection of public health and environmental challenges. Earlier, she managed the Minnesota Children's Cabinet under Governor Mark Dayton, focusing on early childhood development with an equity lens. As a public health researcher, her interests include women's and children's health, healthcare access, environmental justice, and chemical exposures. She also hosts the Beautywell Talk podcast. Amira holds an MPH from the University of Minnesota and an executive certificate in nonprofit leadership from Harvard Kennedy School. She was a policy fellow at the Humphrey School of Public Affairs and a 2020 Bush Foundation fellow. Her impactful work has been featured extensively in local, national, and international media, including CNN, the New York Times, NPR, Good Morning America, and PBS NewsHour, highlighting her role as a global advocate for health equity and environmental justice. And without further ado, welcome Amira Ottaway.
Thank you so much, Gail, Lauren, and Sarah for having me. So let me share my screen just a second. Okay. Thank you so much. I am really excited to be with all of you today and share with you this issue that has been impacting many communities. It's a huge public health crisis that's deeply rooted in communities, not only communities in the US, but global communities. But first, I want to start with introducing you about myself and why I have founded the Beautywell Project. So I'm a public health practitioner, originally from Somalia, migrated to the US 27 years ago due to the civil war that happened in Somalia. And so I'm someone who had lived the experience of colorism, but also people around me experiencing colorism. At very young age, I grew up, people always commenting on my skin color. And so because of the darkest shade of my family. And so that is so much embedded in many communities and in many families. And so that leads to people using these toxic products, and it has been impacting their health. So the reason that I found Beautywell is that for many years I worked in the public health systems, local public health, state systems, but also partnering with federal health systems. And I started the issue of researching skin lighting chemical exposures about 15 years ago now. And so when I started collecting random samples from communities, from ethnic stores, and then asked the Department of Health to test, it showed high levels of mercury. At the time, I remember the highest level of one cream was 39,000 parts per million of mercury level, where the FDA threshold is 1 parts per million. And so then I went into the public health systems, asking them to address this issue. It seems that some of the counties were not listening. I remember one of the metro county actually telling me that this doesn't impact a lot of communities, and so that is actually when I realized the issues that disproportionately impact communities of color. It does not get addressed unless we advocate and do upstream public health policy changes and make sure that we raise awareness. And so I left my longtime public health government work that I did for 17 years. And then I went into establishing Beautywell as a nonprofit. So I registered in 2017, but I fully transitioned my government job January 2019. And so since then, I have been full-time doing the work of Beautywell and systematically addressing the issue of colorism as a way of root cause of toxic cosmetics that we're dealing with today. So in my presentation outline today, I want to highlight the root cause of colorism. Why colorism? When it comes to these kind of cosmetics that we deal with, chemical exposures and the health impact, environmental justice framework, and the Beautywell's model, the work that we have been doing and that become model now for global communities to address the issue of skin lighting, and then call to action at the end. So the definition of colorism. So basically, the term colorism was coined by Alyssa Walker in 1982. But colorism has been in existence way before that. It's just that there was no name for it. But the practice of colorism has been in existence way before that. And the preference for light skin, it's a historical thing. So the simplest meaning of colorism is that it's an outgrowth of racism. It's a skin color discrimination. And what's so unique about colorism is that it happens within groups and outside groups. When I say within groups, groups that share the same ethnicity, the same race can discriminate based on skin color. And then also outside groups that are not part of the groups of color. So it's a deeply rooted issue that made a lot of global communities now to deal with as a way of health disparities and so many issues that I will be sharing with you today. So historically, it's deeply rooted in many cultures because of colorism. It comes from during slavery and then also colonizations, countries that especially went through colonizations. And so the world was introduced to the concept of whiteness. If you are white, you are the best. if you are white, you deserve to get economic well-being. If you are white, you are beautiful and all of that. And so that became so much embedded in many cultures that now their social status, their privilege, their intelligence all depends on how light they are. Their economic well-being. I have talked to communities in Latin America, communities in Africa, and they all share that similarities that if you're light skin, your chances of even getting into political position is higher. If you're light skin, getting into position in media or modeling, it's way high. So that centers around their social status. And so then it becomes so much embedded in many cultures. And so now we have global beauty standard that's centered around whiteness. And then you see people using all of these skin lighting products and these other toxic products intentionally to change the skin color. It's a highly prevalent in Asia, Africa, Middle East, and now in the US or even in Latin America, we are dealing with this whole use of skin lighting products, but then chemical exposure is that is now global public health crisis. So toxic beauty, as I mentioned earlier, it's a culturally have been internalized, and so it become part of many cultures, and so people will comment to each other based on the skin color. It's part of the media, and so you will see advertisement that heavily focus on light skin shade, how that is more beautiful than darker skin shade. And so to give you an example, this picture that I shared here, it was 6 years ago, Dove released advertisement. They were advertising body wash product. And so this is how they explained. And so before you use the body wash, your body is darker, and so implying that you're not clean, and so as you wash your body, you become more lighter, and therefore you are more cleaner. And so there were a lot of outcry within social media, especially Twitter, communities of color being against that. And then Dove actually called back and said, they apologized, and then that led to them creating Department of Equity and Inclusion, hiring people of color to help them strategize their marketing and all of that. So imagine Dove is one of the largest global company that produces personal care products and beauty products. And so them advertising that was something that was very outrageous, but that tells you that is how normal it is for cosmetic company and industry in general. And they target this communities of color, vulnerable communities, and low-income countries globally to use these products. And so this also leads to serious health disparities for individuals to experience. And then also, as I mentioned earlier, it's a deeply rooted of economic power and in general opportunities for power when it comes to political participation and other participations. So this is a global market that's keep growing. So now it's estimated 9.2 billion. And so we will continue to see the growth of the skin lighting market globally. And then the demand will continue unless we actually dismantle the colorism. So it's an industry that is now benefiting from communities of color, but also know that it's an illegal trade. And so most of the trade of mercury that we see in these products are illegal. And so and countries don't even have strong regulation systems. Even if they ban these chemicals, their regulatory system is very low. And so you will see all of these illegal trade that is happening globally, including in the United States. And and then as a result, it's impacting communities because their government is not protecting them. And so you have this illegal influx of products that are widely available to communities. And so that leads to a public health crisis. And then chemical exposures and health in general. So the unregulated cosmetic markets in the US. So if I use example in the US, skin lighting products are in general widely available, and they consist of creams and soaps and lotions, sometimes now injections. I know that the US doesn't allow some of these injections. There has been a clinics that get opened in New York, but it was closed again. And so the US in generally regulates those like places that open to do injection skin lightings. But the creams and the soaps are widely available. And so to give you a little bit global picture in terms of prevalence, WHO have done 7 years ago prevalence study, and they did it in few countries. And so they did several countries in Africa, and they saw the highest usage of skin lighting products globally was Nigeria. 77% of Nigerian women do use skin lighting products. The second highest was India, 44%. And then the third highest was Thailand, the Philippines, and the list goes on. So it shows you the continent of Africa. It's the highest use of skin lighting global, and it's the highest illegal trade of these cosmetics. And so now we have all of these communities now in the US. And so you have these illegal trade going on within the US. These products are coming, and then we don't have a strong regulatory system or regulation at all. So to give you historical perspective, the last time the US Congress enacted legislation on cosmetics was 86 years ago, before 2022. And so right now, the Modernization Cosmetics Act, it's in the process. However, FDA requested again extension. And what this will do is that any company that is formulating cosmetics or personal care products there now will be required to submit safety ingredients sheet and also what ingredients that they're using. So that will help with some of the regulatory systems. However, that's still it's not in place. So they asked extension, and so they're still working on. And so you still have, so anybody now can formulate cosmetic products and use any type of ingredient, and FDA will not ask what are these ingredients are in these products. And so that tells you we have almost zero regulation in the US. Thanks to Congress members, especially I want to highlight Congresswoman Betty McCollum, who has been hugely advocating on this and working with us for the past 5-6 years to address the regulatory system in the US when it comes to cosmetics in general, but also the skin lighting issue. So now Congress actually are looking into this compared to before, and I'm talking about 86 years of not even creating any legislation when it comes to regulations. And so now it's moving into regulatory process. However, the process is kind of going slow, but I hope that it will lead to some sort of change. And then the other issue that now we're dealing with, any of the products that we collect from the market and test, on the label, it does not say that it contains mercury or hydroquinone. And so when we test, not only do we see mercury, we see lead, arsenic in one product. So that's the other issue, that the misleading that's going on about these products is some of them are advertised as natural products, natural ingredients like using avocado or other fruit-based ingredients. And it's not true, because some of them that we tested contain 59,000 parts per million of mercury level, when FDA threshold is 1 parts per million. So any level that exceeds 1 parts per million, it's considered toxic. So the type of mercury, so mercury is one of the hazardous chemicals that are in the products. So far, the type of mercury that has been in the skin lighting product is inorganic mercury, and almost 80, more than 80% of the products that we test, or even our partners, state agencies or global partners test, contain high levels of mercury, as I mentioned earlier. And we know that mercury is a neurotoxins issue. It can impact neurologically the person. It can create kidney problems, and we worry a lot about the neurological impact and the kidney impact. And then people can develop anxiety, depression, skin discoloration. And we have seen all of this show up in all of the communities that we work with, whether it's in the US and globally. And then we have been seeing in-home exposure, thanks to the work that the Department of Health is doing in terms of working with communities and doing follow-up home visit. And so some of the issue that is happening in home exposure is that when women use these products, especially mercury products, it contaminates the whole home, the environment. And so the whole air test is positive for mercury. What that shows is that exposure is not limited to the person who's using, but it impacts the whole entire family, but also those who are visiting them. And so this is another huge environmental in-home exposure of mercury that we are seeing in Minnesota, but also nationwide. So the Minnesota Department of Health did recently, a few years ago, biomonitoring study. This was part of our advocacy, advocating through the state to make sure that that we know that exposure is happening, to look at clinically what type of exposure is happening, which communities are highly experiencing these exposures, but also clinically, like those who are treating, how can they help these communities to address this issue or screen them the right way? So the Minnesota Department of Health have done the biomonitoring study and selected pregnant women from several communities, including the East African communities, the Asian communities, Latino, and comparing to white women who were pregnant, to see if there is similarities in terms of exposure, but differences as well. And so the study showed high levels of mercury exposure in the urine, especially those pregnant women that their urine was tested. They had higher mercury exposure in their urine compared to other groups that was tested. So Asian and East Africans had the highest exposure, and these women were pregnant women. So this is another example of mercury exposure. This happened in California, where Latino women who used the skin lighting products that contained elemental mercury, which is different than inorganic mercury, She got this product was imported from Mexico, and she used it, and then she ended up in the emergency room, and she was in coma for 6 months. And now she's permanently damaged due to use of skin lighting products that contain high levels of mercury. So this is another example of exposure, and that it's not something that we're just saying, but it's happening to communities. This is another example here in Minnesota a couple of years ago, women who lost her vision due to mercury exposure from skin lighting. And so this particular woman, it took even for a while to find out, because clinically, some of these clinics didn't know what was going on with her until she ended up in the poison control center, and then poison control center reported to the Department of Health, and that's why we asked CNN to cover this story. And so this is a woman who lost actually her vision due to mercury exposure. And so this is another example that exposure is happening in communities. So the other chemical hazards that we are seeing and communities are dealing with is the hydroquinone. Hydroquinone is usually used medically. Dermatologists actually often prescribe because it addresses skin pigmentations and things like that, because sometimes when people had higher exposure to sun, then their skin gets damaged, and so to treat that. However, only 2% of hydroquinone is allowed to be used in the open market. But we have seen hydroquinone level of 17% available in markets, ethnic markets or other markets, or even online, that people can access and use, which we worry about a lot. And we have seen people develop some skin discolorations way of a usage. I have seen some women who have been using hydroquinone-based skin lighting products for 15 years, 30 years. And then some actually develop skin sensitivities. They cannot tolerate any heat, sunlight. They can't even, it's even hard for them to cook because of the heat. So they can't tolerate any heat, and then potentially they might experience endocrine it's an endocrine disruptor, and also it might potentially cause skin cancer. So the other chemical that we see, it's a steroid based creams. And so steroids are mostly used to treat the skin, to address skin eczema or other skin conditions. And again, similar to the hydroquinone, doctors prescribe. But what we are seeing in the market is that it's a highly pollutant steroid-based creams are available in the market. And so these women have been using a very long time, and it's impacting their health. I have seen women, as I've been traveling globally, I have seen women who have developed metabolic diseases, who have developed Cushing disorder, some women who developed blood pressure, and also diabetic as a result of the use of steroids. And so the steroid, the natural production steroids of their body actually even it's this suppresses. And so sometimes what happens to them, some of them, they develop addiction. And for many years, we have been partnering with a dermatologist called Dr. Crutchfield. He passed away 3 years ago. And Dr. Crutchfield always will call me and share with me stories of women developing addiction. And so it's hard for them to stop right away. And so what he used to do is that wean them off slowly. So if they were using 7 days a week steroid-based creams, he will change them to use 5 days, 4 days. so that eventually steroids comes off of their body. Otherwise, they will experience addiction to the steroid use. And so we see high steroid use of skin lightening. And then the other sad part is that some women might mix multiple product is mercury, hydroquinone, and steroid, and the reaction is even much worse than using a single product. So the health disparities that we see, part of it is the intergenerational risk of mercury exposure or other chemicals, because women are using during pregnancies. And we know that during pregnancy, mercury can pass through the fetus. And then also during breastfeeding, mercury can go through the breast milk. And so it can neurologically impact the child. And I'm talking about a host of neurological issues that can happen to the child. And so we're talking about generations to come and cycle of exposure in communities, and then also exposure to contaminated clothes. One of the example is that the research that the Department of Health and Pollution Control have been doing is that when they go into homes and test the air quality of these homes, and the homes have higher mercury air in the home, they have seen also, they tested washing machines, and they have seen higher mercury in the washing machine. And so that will tell you, even the person who is not using, if they wash their clothes in that washing machine, they will likely get exposed to it as well. And so we're talking about intergenerational risk of multiple chemical exposure and an impact on early childhood. So environmental justice related. So the issue of colorism, it's a very intersectional issue. So when we talk about environmental justice, we know that colorism, it's a huge social drive for people to use skin lightening products because of they want to, for survival reasons, they want to become lighter skin. And so then as a result, we're dealing with communities that are disproportionately experiencing exposure due to unregulated and illegal products that are available in the market, which potentially will impact their environment. And there's no programs, actually federal programs in terms of government funding that are even available to address this as an environmental justice issue. So looking at the systems, as I mentioned, in terms of environmental injustice, we have systems that are not regulating these products that are widely available within communities. One of the things that I have seen is that communities that use these products, they're not safely disposing mercury. They're just throwing into the trash, and so that ends up in the environment. And so by default, it impacts everybody. And I want to say this to challenge the public health systems that I first went to address this issue, and said to me that it doesn't impact every communities. It really impacts almost everybody, because if this product ends up in the environment, it impacts all of us, even those who are not using. And so this is also a huge environmental injustice issue. The lack of FDA enforcement. I mean, FDA has been, I want to give them credit too. Congress have been addressing this issue in terms of funding FDA to address and come up with regulation, but regulation has been very slow. And then we're dealing with stores, normal markets. And then you have online markets, platforms that sell these products that people can buy in larger supplies. And then targeted marketing to specific communities that use these products, and then the lack of urgency to address this in the public health systems. And in general, those that address in a larger systems of public health, it's not addressed or seen as an urgency when it comes to addressing air and water quality hazards. This is another huge hazard that is happening to almost every communities of color that live in the US, but it's not addressed as the way it's supposed to be addressed. And so this is also a huge systematic issue. So actionable strategies, in terms of Beautywell's work and the model, the way we approach this work, it's a very intersectional work that we do. So we do policy and systems change. We do community-based research, health education and empowerment, community healing, and then youth empowerment, which has been a huge part of our work. And I will go through each one of them. So in terms of policy and systems change, our work, it's not only the state level. We try to do policy and systems change on the federal level, but also globally. Unless we really address the source of illegal trade, we will not see much of a change in terms of products that are widely available in our states or in our communities. And so we have been trying to advocate through Congress, and thanks to Congresswoman Betty McCollum, who has been very much helping for the past 5 years. She was able to advocate and pass funding for FDA. FDA has been getting funding last 4 years to come up with strategies to regulate skin lighting products, but also funding local communities in several states to do community outreach and community education. And so that has been happening within the last 4 years, the help of Congress. And I just want to mention a story. It took me 8 years actually to even access to talk to FDA. I will call FDA and email, and they will completely ignore me until I went to Congress and advocated through Congress. And thanks to Congresswoman Betty McCollum, her office and her staff helped to develop relationship between us, Beautywell, and also FDA. So sometimes I think if we cannot address issues in a local level, we have to go on the federal level to make sure that we address in upstream way. We have been also collaborating closely with UN Environment UNEP to address this issue, and also WHO. So early this year, January, I was able to go to Gabon and train 14 African countries to come up with model to train them, coming up with model to address this issue in their countries. And now, with the help of Jeff, Global Environmental Facility, they will be getting funding. 13 out of the 14 countries now will get funding to address this issue in their countries. And these are the countries that are dealing with so much illegal trade of this issue, but some of these products actually are ending up in the US. And so it has been really great to partner with global communities to address this issue, and then being very active in global conventions like Minamata Convention, which addresses mercury pollution. So we also have done corporate accountability in terms of advocating and addressing Amazon, the sale of online sale of these products. We in 2019 we partnered with Syria Club, and we were able to test 15 products that came back results of high levels of mercury. And then we were able to collect 23,000 petitions from individuals from all over the United States. And then we were able to deliver to Amazon here in Minnesota. And right after that, they were able to actually remove all of skin lighting products from Amazon in the US online, and also Amazon from the UK. But only these 15 products. And so we have been since very focal through the federal government to regulate these online products that are widely available, and people are getting in large numbers to resell or even to use in their homes. But this was the second year that we tried. In 2018, we tried, it didn't work, but we were able to actually organize communities and collect 23,000 petitions, and then that actually created impact. So sometimes organizing communities around issue, it's a very effective. We also do community-based research, and this is also the work that we do, also centers around listening to communities, learning about what they use, and then also the trend, how these products are keep changing within the market, what are they using, and so that helped us, led us to FDA funding us to create a database and then knowledge hub where people can go and see the products that tested mercury or lead or arsenic, and that they can see, and that informs them actually the level of mercury. And then they can go into the knowledge hub and learn about what is even a mercury, or what's about hydroquinone. And so that has been really great resource in communities that we serve, and we test this product 2 to 3 times a year to see what's available in the market, and that helps us actually also with our advocacy. We can actually take this to the state legislature or federal and show that these products are widely available in communities. We also do community empowerment, education, and healing communities. I think unless we really heal communities, because this is deeply rooted of a trauma, colorism trauma, which needs a lot of our attention to partner with communities, to work with cultural brokers, whether it's community health workers or community leaders, to address this issue in a way of healing communities. We have been also working with youth to help us address this. For the past 6 years, we have the Young Women's Wellness and Leadership Initiative, where we recruit young girls between the ages of 14 to 18 and train them for 18 weeks in multiple sessions of health and wellness, but also advocacy, leadership, and mentorship. And so some of these young girls now even graduated from college. They are now in college, who are actually now working with us to address this. They're even leading the student ambassador program that we have created this year, that we want to make sure that it's working in colleges and universities. Especially now we're piloting at the University of Minnesota. And so these youths are very instrumental in the work that we do. So actionable strategies, like things that you can do to address this whole toxic beauty standards and the colorism. So basically to avoid the pitfalls of color blindness. And we see that a lot in many professionals. And so that is a huge barrier to institutional change. And so it's very important that I highly encourage, since most of you are in the healthcare system, or most of you are in public health or healthcare system, to actually name this as a social determinants of health in your research. or even in your practices, because it's impacting many communities and it's contributing to the health disparities that we are now seeing. And then talk about colorism. You know, this is something that you need to talk about in your professional settings, talk about within your communities, with your students, and normalize to say this. It's a public health issue. And so the more that actually we hear that within the public health systems, then our policy makers will hear this and make sure that regulation is happening. And then check your implicit biases. We all have biases towards anything, especially related to different cultures, different communities. And so understanding and recognizing your implicit bias, I think it's a very important thing, especially related to darker skinned people, if you are working in healthcare and clinical settings, because we closely work with the healthcare providers, and sometimes we see them hesitating to communicate with communities, being fearful about mentioning skin lightening, and we always tell them and train them appropriate ways to talk to them, especially at the entry point of the clinic when they're going through the patient screening forms, to just ask what are they using in a simply and culturally responsive way to understand what they're using, but also when they are clinically testing, because when they show up in clinics and show up in different symptoms, are you actually screening for mercury exposure or other chemical exposures due to these products? And we have seen gaps in that, but it's improving. And I also want to acknowledge that the Department of Health has been doing a lot of outreach and training to clinics, which is really great, because we want to see ultimately the healthcare systems adopting this to address within their clinical or hospital settings. Celebrate a diverse skin tone, making sure that like that we really redefine beauty standards and make sure that we celebrate people, and then like mention in beauty standard issues in research, in your partnerships and your public facing communications, to actually talk about colorism as being the root cause of some of the health disparities that we're seeing regarding intergenerational exposure, reproductive health exposure, or other chronic diseases that we see related to chemical exposures. So, and then champion for justice in terms of regulations, advocate for a stronger federal regulation and support, what's going on right now, but also making sure that you advocate through the state legislature to make sure that our state agencies secure funding. So last legislative session, we were able to advocate the Minnesota Pollution Control Agency to get funding and make sure that they do a strong regulation. And so we were able, the legislatures were able to fund the agency to hire people and actually move into regulating businesses, and not only regulating actually, but educating businesses, because we want to assume that some of these people who are selling, they don't even know what mercury is. And I'm talking about small shops, small stores that are selling this. And so how do we make sure that the agencies are training and then regulating if they're not listening to what the agencies are telling them? So become advocate and make sure that you support all of these policies. And then the most important part that I also want to emphasize is funding community-led solutions, because this is where most of the work is centered. Because unless we fund and resource local communities that are doing local work, we're not going to see much of a change. And so most of the change or the interventions actually or research should center around community-based work. And I want also to highlight, since I'm at the university space, we want to see more community-based research, and those faculties who are doing community-based research, that they are willing to learn from communities and that the process becomes co-creation instead of the hierarchy process that we see in academia. And so community-based led solutions, it's a very important, and securing funding for that. And then incorporate environmental justice in your research, specifically related to toxic cosmetics. And so now today I highlighted a lot around skin lighting, but I also want to acknowledge we are now doing community-based participatory research with the School of Public Health, the Environmental Health Division, that focuses on hair salons. In the East African community, we're now doing that as a pilot, and we are working with salons to see what type of products, hair products that they're using in the salons, what are the air quality issues in their salons, and then how can we support them. And then we're seeing that some of the product is now came back positive for mercury levels and other toxic chemical levels. And so exposure is happening in multiple ways. And so more research is needed in this area. And then improving clinical screening. I mentioned earlier, we need to see more doctors, more healthcare practitioners, or even in the public health systems to screen this in a way that people can get help right away. So thank you so much, and now I'm open to questions. Let me stop sharing.
Thank you, Amira. We really appreciate all of your
Thank
knowledge, all of
you.
your insight. Most importantly, your commitment to changing the narrative, right? To bringing awareness to it, but also to challenging it. I think that a lot of people are not always aware of the impact of colorism,
Yes.
an international kind of issue. So thank you. I really, really appreciate it.
Thank you so much.
There are quite a few questions in the chat.
Okay.
Let's see. I think the first one here, you mentioned FDA is getting funding to address this issue. From whom are they receiving these funds? Also, who is funding the project for the 13 African countries? And lastly, has there been consequences established for corporations that deny to hold off selling these toxic skin lightening products?
Mhm. These are great questions. And so FDA is getting the funding from federal, from congressional allocated appropriation. So Congress is funding. And so Congress has been funding FDA last 4 years. So this is for them to regulate, but also to support local communities who are disproportionately impacted by the use of these products and exposure related. And in terms of the African countries, the funding, it was funded by a global environmental facility known as CHEF. CHEF is based in Washington, D.C., and they have funding that several countries fund. And so they hold the fund and then fund countries that are dealing with environmental issues, environmental justice issues. They also fund climate change issues. And so they mostly focused on low income and middle income countries, that especially underdeveloped countries. And these are African countries that fit in the category of underdeveloped countries. And then the last point of holding these systems accountable. And so this is the thing we have been trying to address these cosmetic industries in general, but it needs higher up enforcement level. And so we have been also going to federal level, not us. Also, there's national groups that have been trying to advocate against Amazon, eBay, and the list goes on. We even have some international online based like Alibaba, who has been also sending products to US based stores. And so it's an interconnected system that needs larger enforcement from the federal government.
Nice. Thank you. Thank you for answering that. I think we have time for maybe one more question, so I will ask the next one in the chat. What do you think is the best way to advocate for stronger federal regulation of skin lightening products, a more broad regulations with cosmetic products, or specific regulation for skin lightening products?
That's a really great question. The first thing that you can do is contact your congressional. Everybody here has a congressional member. Wherever you live, you have senators. Call their offices, explain to them what this issue is, how it's impacting you, send letters to them. All of that, all the letters that you send, the phone calls, they will get it and they will take action. You can also talk to your congressional to introduce legislation or ask to include in the appropriation. So Congress has appropriation of funding each year. And so make sure that appropriation continues, that FDA gets into taking more action and regulation. And so simple phone call can address that. Or even if you come together as a group and if you want to travel to DC, we also have been doing that and we want to continue to do that. So you can also join us by way of advocacy. Or even you can go there and meet with your congressionals to advocate. So there's so many ways to do. You can also do publications. You can write op-ed, by just sitting and from your home. Actually, you can even post through social media. So now there's so many platforms to do advocacy without even traveling to Washington, D.C. or going to your state legislature. So I highly recommend you to do publications, whether it's a peer review publications, to also do op-eds, to do blog writing or social media posting.
Thank you, Amira. I totally agree with everything you just stated. So to wrap us up, I just want to let everyone know, remind everyone of the evaluation that will be sent after this meeting, but I also believe it was put in the chat. Our next GIF will be January 21st, so save the date, and it will focus on public health communications. There is not an event page up yet, but I just wanted to put a save the date out there for folks to be looking for. Again, Amira, thank you so much for your words, your wisdom, and your knowledge. It's very well informed and very timely, and we really, really appreciate you being here.
Thank you so
Everyone,
much,
please
Jane.
have a great day. Please reach out if you all have any questions. And again, this will be shared via our website and our YouTube.
Thank you. Bye, everyone.
Hey, everybody.